Good afternoon. Thank you all for being here today, and thank you for wearing your mask. I appreciate that effort. There's lots of big news to be announced today, but of course, we all know that's pretty much been the case over the last few months. From the prison riots that began before I took the oath of office, to state agency to corruption, to historic flooding, to the Easter tornadoes, to the COVID-19, to the historic protest, and the fact that on day 6 of hurricane season, we had our third named storm hit the Mississippi Gulf Coast. It has been a very challenging time in our state. But I'm very pleased to be able to announce today that some of the best news we've had on the economic front over the last several months can be announced. And that is that the Back to Business grant program will be live tomorrow at noon. We need to always remember that this pandemic was not just a public health emergency. It plunged our country into the greatest job loss since the Great Depression. The economic damage and the human cost of it has been incalculable. We need to do everything in our power to take care of our neighbors in these challenging times. We need to do everything in our power to take care of our small business owners. Just to remind everyone about the Back to Business grant program. This is a program funded through the CARES Act where small businesses can be reimbursed for up to $25,000 of expenses related to COVID-19. It's only for small businesses with fewer than 50 employees. No major corporations will be allowed to take part. There are two ways to calculate what you qualify for. You can get a base payment of $1,500 plus $500 for every employee. Or you can go through and actually submit receipts for all COVID-19 related expenses. Things like masks, hand sanitizers, extra cleaning, rent, payroll, utilities, or other costs. This is a grant program. This is not money that you have to pay back. We've got $40 million set aside for minority-owned businesses and women-owned businesses for the early days to make sure they get their fair share. My expectation is that there will be ample funds for everyone who applies to be successful if you meet the criteria. There should be plenty of money available for everybody to get what you qualify for. As I announced last week, same is true today. You can go to backtobusinessms.org and see all of the rules that surround this program. As with any program that deals with federal money, there are a lot of rules. In fact, there are probably too many rules. But if you want to maximize your money, I'd encourage you to go to the website and get familiar with those rules. That same website, backtobusinessms.org, where you can get the rules and the information today, will be available at noon tomorrow, and it will house the portal where everyone can fill out the application to qualify. I will tell you that in the last week, we have had 12,500 individuals go onto the website and ask to get an immediate email alert when this goes live. That will occur sometime tomorrow afternoon. But also, the legislation that was passed also allows for the Secretary of State to be sending an email to many eligible businesses as well. I would expect that you will receive an email very, very soon from Secretary of State Watson. I also want to provide a quick update on the other portion of the CARES Act funds that have already been approved. There have been 10,797 checks of $2,000 each that have gone out from our administration. That's a total of $21,594,000 in checks have been sent to small businesses that were forced to be shut down by their government. I'm grateful for the quick work of the Department of Revenue, the Department of Finance Administration, and others in state government, and I'm grateful that the checks will continue to go out as anyone who qualifies for that immediate assistance. I also would like to take the opportunity today to announce a few changes to our safe return order. As a reminder, these changes should not be taken as a signal that the risk of COVID-19 is gone. COVID-19 is still here. Dr. Dobbs is going to give you the details on the new number of cases and the new number of fatalities in our state, but to suffice it to say, the numbers are not declining. And when you consider the fact that Memorial Day weekend was 2.5 weeks ago, and these large protests have taken place throughout our state over the last 10 days, I'm concerned that those numbers are not going to decline significantly anytime soon. COVID-19 is still in our communities. COVID-19 is still deadly. COVID-19 is still contagious. Now, so many of us, from the press to the politicians to just people back home, want COVID-19 to be over. I want COVID-19 to be over. But the data suggests otherwise. What these changes in our safe return order do indicate is that we recognize the cost of continued shutdowns, and we recognize the cost of heavy regulations. Earlier today, I signed an executive order to remove the curfew on restaurants and bars that serve alcohol, provided that they continue to do their best to reduce capacity to 50%. That should allow many workers to get closer and closer to a normal paycheck and get closer and closer to normal hours. We're also, in that executive order, allowing fitness centers and gyms to increase capacity up to 50% from the previous level of 25%. We're also allowing reception halls to have 50% capacity if they arrange themselves in such a way that is similar to a restaurant seating chart. We're going to continue to allow arenas to host events with no greater than 25% of the seating capacity, with other safety measures in place. In addition to that, you will recall several weeks ago, we signed an order which encouraged government operations to open back up. I've been very pleased in hearing from our new Commissioner of Public Safety, Commissioner Tyndall, for instance, as he has visited DMV facilities throughout our state. I have seen pictures of them properly socially distancing. I've seen pictures on Monday morning of long lines, and I've seen pictures today of less long lines. But in every instance, I've seen pictures of government employees working hard to help their fellow citizens. I want to thank the men and women at the Department of Public Safety who are working hard to get those operations back more close to normal. But I will readily admit that the order that I signed several weeks ago was a suggestion. This morning, I signed an executive order that all government agencies would resume normal business operations with as many safety precautions as humanly possible, no later than July the 1st. There are services and work that you pay for as a taxpayer, and we need to make sure that you are not denied services for longer than appropriate. I understand that each of these announcements would in and of themselves be a lot for any one day, but not for today. I also want to announce that last night I signed a proclamation to declare a state of emergency in the state of Mississippi in response to Tropical Storm Cristobal. As the waters have receded, we've been able to calculate that there was in fact extensive damage that this storm did. There was no immediate loss of life or immediate injury that we are aware of, or at least that I am aware of at this time. Thank God. But we do know that there is significant damage to beaches, to utilities, and to other infrastructure throughout our state. This will allow us to get federal resources to help in the recovery effort. We are committed, in spite of all of the challenges that we face, all at the same time, to do everything in our power to help all of our fellow Mississippians in the aftermath of this tropical storm. Today is actually day 10 of hurricane season. We've had 3 named storms. Given the way in which 2020 has gone thus far, I expect us to have many, many more. But we are prepared. We have the best team possible. We will do whatever it takes to help our fellow Mississippians. With that, I'm going to turn it over to Dr. Dobbs, who is going to give us an update on COVID-19. Dr. Dobbs?
Thank you, Governor. Today, the Department of Health are reporting 374 additional cases of coronavirus, bringing our total to 18,483. We have a total of 868 deaths of Mississippians, and sadly adding 20 more to that list, or of that 21 have been added today. If we look at other metrics of kind of where we are as a state, we do see continuing growth in transmission. We do see this transition from an older middle-aged age group to younger individuals who are being diagnosed. We're seeing also additional strains on our health system. We haven't had some of the sort of the acute stresses that we were watching closely a couple of weeks ago, but if you look at our data, we're recording 441 hospitalizations, 171 ICU patients, which is the largest that we've seen in quite a while, and 100 patients on respiratory support or ventilators. So, this is not going away. We're going to continue to have it, and it does concern us very much that it's these things happening in the community, social events, people gathering in ways that are unwise that are driving some of this. One of the scenarios that we're seeing over and over again, and this is going to, I'm really fearful, is going to play out pretty quickly in mortality and severe illness, is we're seeing young individuals, and we're tracking this back in our case investigation, who go out to a party, they're hanging out with friends, things that actually don't even meet the criteria for under the executive order. They're getting coronavirus, they're taking it back home, and either they live with their parents or they live with their grandparents, multi-generational housing, and transmitting it to the older folks, and it's leading to severe illness and even death at times. So this is something that we've been talking about, we've been predicting, and it's starting to occur. So please, I'm about to say, if you're over 65, avoid your grandkids, unless they know how to behave, because we're going to continue to see more and more problems unless we honor these social distancing issues and respect them. One thing I did also want to address really quickly is a WHO employee made some statement about asymptomatic people not spreading the coronavirus. Absolutely not true, unwise statement and misleading. It's a little bit of an issue of her being overly precise and confusing people. But let me just be very clear that people who are asymptomatic do transmit infection. There are different types of asymptomatic. There are people who never get any symptoms. They just have virus and never get symptoms, and that's what she was referring to. And they still can transmit infection, although less likely. But the other person is the people who don't have symptoms yet. And they're asymptomatic, but are oftentimes referred to as pre-symptomatic because they will get symptomatic later. And as a very clear example of this, we had part of our investigation, we had a card game where 9 people were there. one person was there, had no symptoms, but got sick a couple days later, gave it to 7 of the other 8 people. So that's an asymptomatic person, someone with no symptoms, at a social event, giving it to the vast majority of people that they're around. So please understand that there is risk from people with asymptomatic shedding, and that's why it's important to maintain social distancing. It's important to wear a mask as appropriate, especially if you can't maintain 6-foot separation. We need to pretend that anyone that we encounter, even if we know them and even if we saw them last week, could have coronavirus and take appropriate steps to be protected. And that's all I have, Governor. Thank you.
Thank you, Dr. Dobbs. At this time, I'm going to turn it over to Director Michelle, who's going to talk about the emergency declaration for Cristobal and other related events.
Yes, sir. As the governor mentioned, he did sign a state of emergency last night for Tropical Storm Cristobal. One question that we're getting a lot is, why did the state of emergency get issued so late? This has been fairly typical with us, and I will tell you that I am very reluctant to ever ask the governor to request a state of emergency on the front end. All of the county emergency management administrators had everything under control, have been preparing for this for weeks. They did, in fact, anticipate the storm and all the effects came about. However, there were additional undercurrents and surges that they had not anticipated, and as such, the damage, when the water started receding yesterday, it was evident that there was extensive damage to the beach. There's a large amount of wildlife, as far as animals that had deceased along the beaches, is going to require a certain amount of a certain process to remove that. Just in Hancock and Harrison County alone, the damages are looking to exceed $5 million. We anticipate that there will be similar damages in Jackson County. So there is significant damage and significant amount of expenses that those municipalities will have to endure to get that. Therefore, this is very much warranted a state of emergency, and we do anticipate requesting a disaster declaration to FEMA once these damages are validated. With regard to PPE, just real quick, we did suspend deliveries for PPE for the 2 days of Tropical Storm Cristobal. We did resume those deliveries yesterday. Yesterday, there were 22 Tier 1 facilities that received delivery of PPE. Today, we are delivering Tier 1 facilities PPE in Districts 4 and 6. And then tomorrow, the county pod deliveries will resume to the 82 counties and the band of Choctaw Indians. The Battelle system is starting to build up capacity. We still have 114 facilities registered to use that. As of today, we've got a little over 300 masks that have been worked through there. We still have a lot of capacity, so I just want to reiterate the use of that system by healthcare facilities, long-term care facilities, and the like. Just a quick update, we did announce at the last press conference that FEMA had been in receipt of our request for the Federal Declaration, Public Assistance Declaration for the storms of April 22nd, 23rd. Just a reminder, FEMA is reviewing that now, and we anticipate we anticipate an answer within the coming weeks for those 11 counties that we did request. And then finally, just as far as the outlook for hurricane season, still very early in hurricane season. Looks like we will have a break. The weather should be nice this weekend, but as you can tell, the temperatures are rising very rapidly outside. It's very hot. So just want to remind everyone to hydrate when you're outside. Make sure that you're seeking shade during periods of time. And a big reminder about your vehicles. The heat inside your vehicle rises exponentially when you park that car. Please do not leave kids and pets inside your vehicles, and just make note of that and just be aware for the hot temperatures that are coming about. Governor, that's all I have for today, sir.
Thank you. Questions? Courtney Ann.
Governor, extending that order, although making some amendments, it seems as though as the cases and hospitalizations stay steady, the restrictions are having to kind of follow suit. Can you speak through that a little bit more? Particularly, I know that you said the strain, Dr. Dobbs, is not quite as much as what we were seeing, but I know that sounds like it's always been one of the big factors in making some of these considerations.
There's no doubt. I think if you look back over the last 6 to 8 weeks, and the total number of patients in ICU beds of approximately 160, the last I looked, the total number of patients on ventilators right around 100, I think yesterday, 99 reported today. Both of those levels are certainly manageable, but they're also at a level that is as high as we have seen for a long time in Mississippi. And the reason for that, as Dr. Dobbs has so correctly pointed out is in large part we're shifting, whereas in the early days we were only testing those individuals that were symptomatic, that that could more or less prove that they were symptomatic, and we've expanded testing considerably, and that's one of the reasons that we are seeing additional cases. But what we're seeing also is a shift, because we remember in the last 2 weeks of May, we tested everyone in every nursing home. We tested every resident, and we tested every person coming in and out. Now, that doesn't guarantee that there will be no new cases, because unless you're able to test every single employee every single day before they get in and get a result within 10 minutes, then there's always the possibility that they can bring the virus in. But we're seeing a bit of a shift, I think, in terms of the cases whereby a lot of the cases early on were from those individuals. Now, as Dr. Dobbs said, we're seeing more and more cases amongst young people. And the reason that concerns me is many of these young people are going to be perfectly fine. Some of them are going to be asymptomatic. But if you have major parties on Memorial Day weekend that go beyond the scope of the executive orders, or if you have major protests, which we know that we have had in our state for the last 10 days or so, a lot of young people contract the virus, some of them asymptomatic. That's about a 2-week process, so we'll know what that looks like a week to 10 days from now. But the issue is many of them are going to go back, as I said yesterday, and have Sunday lunch with their grandmom, or they're going to go to church maybe with their granddad Sunday night, or something along those lines. And I'm concerned about what that then community spread looks like, and puts more and more of those individuals in the vulnerable category at risk. My hope would have been that we could have no restrictions in Mississippi in the month of June, but that's just not what the data suggests. And you know, there's been a lot going on in this country. There's been a lot going on in this state over the last 2 to 3 weeks, and there's been a lot less conversation about coronavirus. There's been a lot less conversation about COVID-19. There's been a lot of people in our state that just convinced themselves that it's over. And I'm telling you, it is not over. It is the reason that we are having these press conferences every single day. It's the reason that all of you are covering them. I'm probably, and these two who are working overtime every single day, we're spending between 6 and 8 hours a week alerting the people of Mississippi to the importance of paying attention, of doing the little things so as to slow or stop the spread, such that we don't put more and more people at risk. And that's really what we're trying to get to. Ross?
Governor, did you say you're lifting the 10 p.m. curfew on bars and restaurants?
We are.
There was a group of bar owners and musicians outside protesting.
Oh, really?
They haven't been able to get back to work. They're losing money. So they will be able to reopen with that 50% capacity?
That is correct, yes. I did see a group. I didn't know exactly what they were doing, but it is true that earlier this morning we signed 2 executive orders, one of which allows for the curfew on restaurants and bars to be removed. They still have to do their best to reduce capacity to 50%. We want to continue to maintain social distancing. And I will tell you, it is, if people are in those facilities at 11 o'clock or 12 o'clock or 1 o'clock, I think we all are smart enough to know it is less likely that they are going to maintain social distancing. It is less likely that they are going to adhere to what we hope that they will do. But it's also true that if you have a facility that is open and they do maintain social distancing, it doesn't make any difference if it's 6 p.m. or 3 a.m. If they are adhering to the rules, there is a way to do that in a safe, responsible way. But yes, we did lift that particular portion of the Safer at Home order earlier today.
That takes effect Monday the 15th, though, right? When this current one expires, this new one begins. Is that
Let
right?
me, I want to answer you. That's the government order that goes into effect. This particular executive order goes into effect at the end of the current executive order, which would be 8 a.m. on Monday. That's correct.
Governor, with the back to business grants, do you foresee the state or the state with federal money doing anything beyond that? Is more needed or more being looked at as far as any kind of business relief?
Well, I think this is a good start. I think that the fact that we've been able to already send out 10,797 checks to small businesses, is all of which were shut down by government order, is a very good start. We've got more work to do. We're going to continue to look for ways to help our small business owners. What I would tell you, the biggest next step to help small businesses, in my opinion, from the CARES Act money, and it's not going to be immediate, but it's long-term relief, is going to be ensuring that we get adequate CARES Act funding to replenish the trust fund at the unemployment insurance. Our trust fund at unemployment is funded not by general taxpayers, it's funded by employers, primarily small businesses. We currently have an experience rate of 0.2%. The Department of Employment Security has alerted the Mississippi legislature and myself that if unemployment rates, and obviously these things require significant amounts of assumptions, but unemployment rate in Mississippi is about 15% today. If the average unemployment rate in our state is 12.5% for calendar year 2020, the average rate, obviously we're halfway through and it's well over that, but if we assume 12.5%, that means, according to Jackie Turner and her team, that regular experience rate would increase from 0.2% to almost 2% of payroll in calendar year 2021. That increase means for a company that employs 50 people, their overall tax rate would increase from approximately $1,400 in the example they use to almost $14,000. And the only way in which to keep it from increasing by that amount is for the state of Mississippi, specifically the Mississippi legislature, to take $500 million from the CARES Act and replenish the trust fund. Now keep in mind, Mississippi's trust fund prior to COVID-19 was one of the 5 most solvent trust funds in America. And Ms. Turner has asked for $500 million. So you can imagine what's going to happen to small business owners in virtually every other state, because they're not going to have the ability to replenish to the extent that it is needed. And so when I think about the longer term effects of COVID-19 on small business owners, it is imperative that the Mississippi legislature spend that $500 million in CARES Act monies to plus up the trust fund. And it is also very clear to me that should they choose not to do so, there is going to be a significant tax increase on small businesses at what I would, and y'all have covered me long enough to know that I'm never for an increase on small businesses and taxes, or anyone else for that matter. But this would be the absolute worst time for there to be an increase in taxes on small businesses. And so, again, I believe that this nearly $300 million is a good first step. I believe there's going to be adequate funds to get the monies out to those small business owners that qualify under both the federal and the state regs. But I think the next step, this is a short-term fix in which we are getting money in their pockets immediately to help defray their expenses caused by COVID-19. There's also that longer-term fix by replenishing the trust fund. Renee.
Dave Elliott from WLOX has a question.
Thank you, Renee. Governor, earlier this year, Senate passed a bill to raise teacher salaries because of deficits related to coronavirus. That died in the House Education Committee. Revenue down this year, probably even worse going into next fiscal year beginning July 1st. Lawmakers have told me we may see cuts across all state agencies. Is anything considered sacred or cut-proof in your mind? or is everything on the table?
Well, my general approach to budgeting is that most everything is on the table, although there are some agencies that have federal guidelines and federal mandates and, quite frankly, general statutes passed by the Mississippi legislature that mandate spending at a certain level. And so what I would tell you is, and I've spent a good bit of time in the last 72 hours reviewing revenues. If you look at where we are coming out of the end of May, which is the 11th of 12 months in our current fiscal year, when you consider the fact that our April 15th individual income and our April 15th corporate income taxes that were due on that day were delayed until the middle of July, when I look at this particular fiscal year, I do not anticipate that there is going to have to be any major cuts in the current fiscal year. Now, the current fiscal year is over in 20 days. We have an additional 60-day lapse period, which we will deal with, where revenues come in, expenditures go out. But we have not determined that a cut would need to be made for the current fiscal year. There were talks early on. I heard some suggest that revenues would be down $600 million to $1.2 billion in the fiscal year that begins July 1. I believe that is overly pessimistic. I have always believed that we need to be conservative in our revenue estimates and we need to be conservative in our budgeting. But the fact is, we came into the current fiscal year, and admittedly I was very engaged and involved in the budget for the current fiscal year, but we had a very conservative revenue estimate. We only expended 98% of expected revenue, so we had our 2% set aside, which is just good, strong, fiscal, conservative budgeting. In addition to that, we had collected almost $250 million more in the first 8 months of the fiscal year than was originally budgeted. And so, as I said repeatedly throughout 2019, Mississippi was in the best financial shape we've ever been in. Mississippi was in the best fiscal shape we'd ever been in. Now, I never anticipated that COVID-19 would do what it has done to our economy, to unemployment, to hard-working Mississippians throughout our state. But from the government finance side of things, Mississippi was thankfully under conservative leadership for the last 8 years, and I believe we're going to be able to weather the storm, certainly in the short term. I would anticipate that the legislature is going to ask the Revenue Estimating Committee to meet sometime soon. That would be followed then by a joint legislative budget committee meeting sometime soon. If I knew exactly when those were occurring, I'd tell you, but I've been told that as I look back on 2019 and the overwhelming support from people of all walks of life that we had on the Mississippi Gulf Coast, I do believe that the people of the coast certainly trust me to stand up for what's right. And if that's the direction that the legislature wants to go, I do believe that the residents and the citizens of the Gulf Coast would be supportive. But again, I just learned that bill was even a bill within the last 48 hours. So I will deal with it as it comes to the desk. Jeff.
Governor, across the street, the individual lawmakers and the leadership, I think, are getting bombarded with calls and feedback about changing the state flag, hearing one way or the other. Are you or your office receiving a lot of public input on that?
There's no doubt that there's a lot of conversation surrounding that issue right now, and it's very important to have a conversation. That's certainly ongoing. I've made it clear what my position is, and my position is consistent today as it was in 2019 and the year before that. And I believe that if we are going to have real change in our state, we've got to deal with the issue of the flag in such a way in which all Mississippians can come together at the end, rally around one another with whatever decision is made, and work together to make a better Mississippi. That's what I am committed to. And I will tell you that I spent all of 2019 telling the voters of this state that I believe that at some point, people in Mississippi may want to change the flag, and if and when they do, it ought to be changed by a vote of the people, not by a vote of politicians in a backroom deal in Jackson. And I think if we're going to see the people be able to come together when it's all said and done, whatever the decision is going to be made, that's the only way to accomplish that. And so, you know, I must have spent 10,000 different press conferences in 2019 conveying that exact same message. And I know that there are those who want me to change my view, and there are those who want me to keep the same view, and there are those who want me to change it and go the other direction and lead the charge to fight any change. But I am going to tell you that my view has not changed. If we're going to change the flag, it ought to be done by a vote of the people. Ross.
The actress Aunjanue Ellis has reached out, or tried to reach out to the First Lady on Facebook, to try to persuade her to maybe be a husband whisperer, maybe persuade you to take action on the flag. Have you spoken to the First Lady about that? Are you aware of that?
I was not aware of that. And I will be honest, I've been working pretty hard here the last 2 or 3 days, and the First Lady was with me, thank goodness, on the Mississippi Gulf Coast this weekend, but we hadn't spent a lot of time talking about this issue or any other issue over the last 3 days, so I don't know exactly when that occurred, but I did not know that. Yes, sir.
Governor, I have a question. You haven't looked this way.
I'll recognize you at the appropriate time.
Okay, thank you.
Go ahead.
Dr. Dobbs, you mentioned the statement and your concerns from the World Health Organization in that statement and how it might be confusing for folks. Are you concerned at all that it could provide more ammunition for the folks who just want to pretend like it's not an issue and not observe social distancing guidelines?
Everybody's looking for a free pass on this thing, whether it's going to be the summer's going to kill it or the virus is getting weaker, you know, and every time we've considered these assumptions of things are just, we're going to luck out on this, we've failed miserably. And so if we look at the science, if we look at history, it's not going away. There's nothing that's going to make it go away until we get an effective vaccine. And so we just got to use those things we know. So yes, it does worry me. People hearing kind of what they want to hear, because we all want to go back to normal. I mean, no one wants it more than I do, I assure you. But we have to take everything in context, understand this is going to be with us. This thing's not over. And every piece of information we get, every comment is not solid gold. And so we got to take it in the context of what else is out there. Thank you.
It's an ever-changing environment for sure. I mean, there's no question about that. Really?
Governor, the Neshoba County Fair canceled for this year. The Choctaw Indian Fair also canceled for this year. And then the political meeting in Jacinto, which is also a big July 4th event, also canceled this year. Did any of you three talk to coordinators or organizers of these events to express concern over the closeness of people and what could happen, especially in light of what you said regarding the age group becoming younger? And a lot of these are millennials, you know, much younger. So did y'all get involved?
I've spoken with a large number of people. I certainly spoke with a number of the folks that are associated with the Neshoba County Fair. I have not personally spoken with anyone up in the northeast part of the state. I've been to J Center at least 10 or 15 times over the last 17, 18, 19 years, and something that I've really enjoyed. It's a great, great event. People still come out up there and put their lawn chairs out and listen to politicians give political speeches. It's rare and unique in these times, but that is certainly something that they do. But when you mentioned that, it's the first I'd heard that they'd canceled July 4th. But I'll also tell you that I'm glad they did, and I will miss going to the fair this year. I've been there 17 consecutive years. I've spoken from the historic pavilion at the Neshoba County Fair. It's a great thing for elected officials. It's a good opportunity for people like me to get out and listen to the people. Because when I get to give a 10-minute speech, I usually stay for a day or so, and I get to listen to a whole bunch of people on porches tell me what they think about a lot of different issues. And unfortunately, in this country today, we got way too many politicians that don't listen to what their constituents say to them. They go out and they do whatever the hell they want to do, and the heck with their constituents. And that's one of the reasons that there's so much unrest and so much distrust in the political system. And so I hate personally that we're not having an Neshoba County Fair this year, But when you think about trying to prioritize getting businesses back open and doing so in a safe, responsible way, you cannot help but recognize that some of the more fun stuff that includes really big crowds, we're probably better off as a state that we don't allow those things to go on. I don't know if you want to address it or not, Dr. Dawes.
And we've spoken with a lot of different individuals. I did speak with some of the organizing committee of the Neshoba County Fair, and we talked about the different risks that would entail and what potential mitigation strategies would be worthwhile, but given just really the, I think just the nature of the fair, I gave them my opinion about, doing it the normal way would be unsafe, and I think everyone could acknowledge that. But I gave them as much input as I could, and they made their own decision, and I really applaud them for the bravery of their decision to protect their communities.
Just so you know, it's the first time since World War II that the Neshoba County Fair is not going to go on as planned. The concern with the fair, I presume, and again, I spoke back and forth with several of my good friends that are involved and gave them an opinion, but certainly didn't put any pressure on them to make one decision one way or the other. But the challenge with the fair is just the living quarters. We talk a lot about the challenge so much with the spread of the virus that we've seen are in communal living quarters. So much of that has been the case over the last 3 months. Well, if you have ever stayed on the fairgrounds, you know that in many instances there may be 10 or 12 or a lot more staying on one floor in one room, and then you go up a floor and there's that many more again. And so they made a hard decision, I know, for all of them, because it's been nearly 80 years since they've chosen not to have it. Again, I hate it because my girls go every year, and I've got a number of my girls go and stay every year. And I actually grew up. I grew up in Florence, and I had a good friend whose mom and dad were from the area, and I went to the fair in my early years with friends, and I stayed over there. It's a great, great, great Mississippi tradition, but unfortunately, just the nature of it and where we find ourselves in a pandemic, the likes of which we hadn't seen since 1918, it just probably is not as safe this year. Joe?
Governor, do you believe the current state flag is representative of Mississippi today?
I believe that the current state flag was voted on in 2001 by the people of our state. They chose to keep the current state flag, and I believe that at some point in the future, it may be sooner rather than later, that at some point the people may decide to change the flag. And if they do, what I would tell you is the best way for us as a state to come together after that decision is made is if it is done by a vote of the people of our state. And I will tell you that, and there's been obviously this has been an issue in Mississippi for many, many years. I've been asked about this question since I ran for office the very first time in 2003. And one of the things that I will tell you is more and more people that I talk to, some of whom were just very adamant that we should not change the flag 10 years ago, 15 years ago. Some of their opinions have evolved, but it has been the one universal opinion that I heard in 2019 is that it should be done not by politicians in Jackson. It should be done by a vote of the people of the state. Ross?
Well, I just got a question about that very issue.
Sure.
It was the legislature in 1894 who adopted this flag. So why shouldn't the legislature make a decision now if, as some people say, we need to make a change?
Well, technically, the legislature or the Constitutional Convention in 1890 did not have a state flag. Mississippi really technically did not have a state flag until 2001. It was the Mississippi legislature in 2001, after the vote, in which they actually put the current flag into state statute, that it was the official state flag. Prior to that, Mississippi didn't really have a flag. We had one that we flew, but we didn't have one that was an actual official state flag. They changed that in 2001. I think as we look back on many of the decisions that were made by the politicians in 2001, they probably wouldn't make the same decisions today that they made then, but I wasn't in office at the time.
That's the same flag. But that's the same flag that was adopted in 1894 with the Confederate emblem.
It is the same flag that has flown over the state since 1890. but it wasn't an official state flag until 2001 after the vote occurred.
Toby Vance with MPB has a question.
Sure.
Having some difficulty unmuting. Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. I've got a two-part question for Dr. Dobbs. Can we get an update on the number of contact tracers currently working on case investigations at the health department? And then the second part is, I know it can vary based on volume and case detail, but I'm wondering about how many investigations they can currently open and close per day, especially as we're seeing more general community spread that's not quite as easy to link to a particular outbreak.
And actually, we do have that report on number of new cases and closures every day. I don't have it in front of me, so that's certainly something we can get for you. As far as the number of investigators, it's going to be over 200. We're adding folks, as we go forward. It's actually a good thing. So watch our social media if you're a nurse or if you want to try to be a disease investigation specialist. If you have a bachelor's degree with a science background, we're going to be recruiting folks and we're going to be hiring. So we're going to build our teams out more and more and more. I don't have a precise number on active case investigators. Also, it's also a little bit of a number in flux because we can recruit people as we need them from our pool of nurses and divert their strategies. But as far as like the number of people we have committed, that's the number. But we are maintaining about 95% completion for all the cases we've had, and a lot of those 5% that are not complete is because they're new ones. Anyway, so I don't have the precise number, but that's something actually for tomorrow. I'll try to get that if we have a press conference. Thank you.
I couldn't tell you a precise number of the number of people who work in any of the state agencies that report to me, so I certainly can't tell you the number that report to Dr. Dobbs. So,
I'm trying to go back to Kobe with MPB.
okay, good.
Kobe?
Hey, can you hear me?
Yes.
Okay. This is for Dr. Dobbs. I've heard MENA's updates on providing supplies to the Mississippi Band of Choctaws Indians, but we haven't heard a lot about members and the impact of COVID-19 on their community and reservation. What can you tell me about the number of cases and deaths among that group, and what concerns do you have for that community?
Yeah, so, and certainly if you go to our website, you can see the, let's see, we look at the deaths. We have 42 deaths among Native Americans or Alaska Natives. That's going to be primarily Choctaw. If we look at the percentages of death, and I don't have that in front of me from the cases, but the mortality rate among Choctaw Nation individuals is far higher than any other group. It's far higher than African Americans. It's far higher than Caucasians. So it's a group that we're very concerned about. We're working very closely with their leadership and also with their public health entity because they have their own independent public health authority that has been actually fantastic. They've been working very hard. So we have a lot of concerns. We want to make sure we can do things to support them. They certainly have a great medical facility and they take good care of their folks. But they also have some of this challenge we talked about of younger folks getting it and bringing it back to the family. It's not unique to any ethnicity or race, but they are struggling with that too. And so we're seeing a lot of cases and a lot of deaths in that group, and it concerns us greatly.
I would just simply point out that the CARES Act does have not only specific funding for states and specific funding for cities over 500,000 in population. The CARES Act also has specific funding for our population of the Choctaw Indians as well. And so we want to work with them, and we have worked with them. Again, Dr. Dobbs leading that effort, but they have also been very diligent, and the chief has been very active personally in their response. Gerald?
Dr. Dobbs, do you have offhand now the number of people on ventilators and the total ventilators? Could you remind us?
Actually, I think I quoted yesterday's number of 100, but it should be 98 today is the number of people on ventilators. As far as available ventilators, I don't have that with me, but it usually runs in the hundreds, but it's a distribution issue, and sometimes it's an availability issue. So I can get that for you tomorrow, but I'm pretty certain the number today for total ventilated patients is 98.
Yeah, just as a reminder, it's one thing to have 500 ventilators in the entire state available for any new patient, but if all 5 of those are in Tishomingo County and all the new patients are in Hancock County, that's the challenge that we find, and that's where Dr. Dobbs and his team, Jim Craig specifically, are every single day monitoring that and trying to make sure that if any one hospital needs an additional ventilator, that we are trying to make sure that we can get that from an emergency management perspective. And fortunately, so far, we've been able to do that, and that's part of maintaining our ultimate goal of ensuring that every single person that can get better with quality care gets that quality care, is the maneuverability of resources from one region of the state, from one hospital of the state to another. Yes, ma'am.
Dave with WLOX has another question.
Governor, members of the DC National Guard have tested positive for COVID-19 after working mass protests in the nation's capital. The Guard hasn't released the exact number. 400 Mississippi National Guard service members were sent to Washington. They came home this week. Do you know if they're being tested? Are they in quarantine? In retrospect, do you regret sending those troops to Washington?
I have not been alerted to any positive cases by members of the Mississippi National Guard that went to Washington, D.C. What I would tell you is that it was very important that in the District of Columbia that there was adequate resources to ensure that the protesting was done in a peaceful way. We were asked by the Secretary of Defense or the President, the D.C. Bureau of the National Guard, to provide help. And Mississippians did what Mississippians do. We stand up and we help our friends and our neighbors. But I don't think there's any doubt that when we look at the protests that occurred around the country, a protest that I support everyone's First Amendment rights to do, we are going to have more cases in America because of the large number of individuals that were in very tight, confined spaces. I don't think there's any doubt about that.
And I'm going to go back to your question, Gerald, if you don't mind, just to give you an update. The total number of hospitalized patients is 442 for today. ICU beds, 156, and ventilators, 103 patients on ventilators. The critical element in the potential shortage is going to be ICU beds, and we have 156 available ICU beds. But again, it's a distribution issue. So sorry I didn't have that immediately.
Janine Mack with CNN has a question. Janine?
Thank you for taking my question, Renee. I have two parts, if I may. I wanted to know from the governor what you would like to see the federal government do to bolster Mississippi's coronavirus response. Other states have mentioned concerns about access to PPE, testing supplies, etc. And then I also wanted to know what's with the last time of the COVID-19 numbers on the dashboard. It seems like it hasn't been updated since yesterday. Thank you.
Okay, thank you for your question. This may not be a particularly popular response in every quarter, but I will tell you that the federal government has been a good partner to the state of Mississippi in our COVID-19 response. We have not received everything that we've asked for, and we hadn't received everything that we've gotten in exactly the amount of time that we wanted. But when you consider the fact that we have received $1.25 billion in the CARES Act, we have received significant grant funding for the Department of Health. We will receive significant funding from the Stafford Act for our emergency management response. There is no way that the President, the Vice President, Dr. Birx, or their teams could have been more available to us. We have done sometimes 3 and 4 conference calls per week where every governor had the opportunity to get on, and every governor that needed to ask a specific question were able to do so. We were able to get things done and expedited because of those opportunities. And so as I look to the future in terms of the federal government's role, I just want to make sure that the federal government continues to maintain their posture, which is natural disasters, whether it's COVID-19, the Easter storm, tornadoes that came through Mississippi, or a pending hurricane. Natural disasters have to be managed in the same way, and that is state managed, locally executed, and federally supported. Mississippians know how to take care of Mississippians, and the federal government, at least as it relates to our state, so far has recognized that and done an excellent job. Thank you all for the questions.
Reporting, do you want to say anything about getting stuff up in a timely manner?
Yeah, so it should be updated now. Sometimes there is a delay between the number of total cases and then getting the dashboards. There's a lot of behind-the-scenes work that has to go on, so sorry for that gap that may occur, but we want to make sure we get the numbers out as quickly as possible. As you can imagine, we have over 200,000 tests and 18,000 cases, and it's a process to sort all those. So, we'll continue. We have, my team actually didn't leave till 3 in the morning the night before last, and I hope they stayed not quite so late last night. So just know that we are on the job, working hard for Mississippi, and forgive the delays. We're always trying to make it better.
Thank you, Dr. Dobbs. Thank you all. Appreciate it.